welcome to Newman University's virtual health science Q&A session. This is designed to be a 30-minute session. We'll hear a little bit about each program, what they do, and a little about their application process, some about the Kansas Promise Act scholarship, and then we'll go straight into Q&A. I have your questions that were submitted in advance, but you can also chat in the chat box at any time if you have questions that you'd like any of our faculty or directors to answer. So without further ado, I will let Margot take it away.
So we're glad you joined us, and we'll start with our brief introductions about our programs. So my name is Margot Wagner, and I am the program director for the Respiratory Care Program. Respiratory therapists work in physician offices, hospitals, skilled nursing facilities, pulmonary clinics, pulmonary rehabs, lots of different locations. We take care of patients anywhere from the neonate, born at 23 weeks gestation, up to the geriatric patient. So we do accept one group of students each year, and those students begin our program in August and graduate the following December. There's about a year of prerequisites that are required prior to entering the program. Students who graduate from our program earn an Associate of Science in Health Science degree and are able to sit for the national credentialing exams. Our students receive approximately 624 hours of clinical experience in our program. And those who wish to earn a bachelor's degree can continue their education while working as a respiratory therapist and then enter our online bachelor's degree of healthcare science program. And a lot of facilities offer tuition reimbursement, so it's a good opportunity to go ahead and get out there working, but still complete your education. Most of our graduates are going to work in a large acute care facility for at least a year after graduation to gain experience before possibly moving into smaller facilities or more specialized areas. And our applications open in February. So we'll go ahead and move over to Nancy.
Hi, my name is Nancy Dahlinger. I'm the director of the Occupational Therapy Assistant Program here at Newman University. We are, a lot of people have never heard about occupational therapy. We're one of the 3 rehabilitation therapies. There's occupational therapy, speech therapy, and physical therapy. Then we work a lot together in the rehabilitation area. So there's a lot of different practice areas. And so what we're mainly concerned about, or our main focus, is to get people back to doing their daily occupations, which is anything you do to occupy your time. So anything you do from when you get up in the morning to when you go to bed at night, and maybe something's happened with accident, illness, or injury, then that you can't do it anymore, maybe you're born disabled, then an occupational therapy assistant can help you regain those skills and get back to a functioning lifestyle that you had before. So we're an associate's degree. Oh, we work in all different settings. We work in hospitals, home health, nursing home, private practice for physical disabilities. We work in orthopedic rehabilitation. We may be working with developmental disabilities with little kids from the NICU clear up to when they age out of the school systems at 21. And then we also work in the area of psychosocial. So if you're interested in bipolar, post-traumatic stress disorder, depression, an occupational therapy assistant can work in those areas as well. So our degree is an associate degree. It's 2 years in length. We have about a semester of prerequisites that you take or complete or be enrolled in to complete before the program starts. Our program only begins in the spring, so we take in applications by September 15th, and we do pre-admission OTA testing, and then make our admission decisions based upon that. And so, excuse me. That's my timer. So it's a great program, a great opportunity to earn a good salary, typically in the high 50s to low 60s. And now I'll turn it over to Teresa.
Hi, I'm Teresa Vetter. I'm the director of the nursing programs at Newman University. And predominantly, I'm going to talk about our undergraduate nursing program, which is a Bachelor of Science in Nursing. So we are a 4-year degree, and nurses are, it prepares you to earn a license to be a registered nurse Registered nurses work in just about every setting you can think of, from hospitals to clinics to homes to the prison systems to military, industrial settings. So registered nurses are just about everywhere. The Bachelor of Science in Nursing, the first 2 years are used to work on nursing prerequisites and general education requirements. The program itself is a 4-semester program, so 2 years. We do 2 fall and 2 spring semesters to complete that bachelor's degree. We do not do nursing classes in the summer. We do enrollments into our program, start a new cohort each fall and each spring. And so we have applications that open on February 1st for the fall semester entry and September 1st for the spring semester entry. We accept up to 32 students each semester. We do have a minimum required grade point average of 2.85. And we calculate that grade point average off of only those classes that are going to apply towards the Bachelor of Science in Nursing. So there could be courses that you've taken towards other things that wouldn't be calculated into the grade point average. So our applications for next fall are opening right away. And after everybody's done, I'd be happy to answer any questions about nursing.
Hi, my name is Jeff Vaughn. I am the director of the Radiology Technology program at Newman University. And it is an associate's degree, but it's kind of like a professional degree for the most part. And you are kind of we have 3 main hospitals here in Wichita, so you can, we use them to start with. So you're in clinical, usually starting the very first semester. We've got, by the time you get done, you're in clinical, you've put in about 1,400 hours, but I know it sounds like a lot, but you're delivering radiation to people. So we really want to make sure you know what you are doing. So we're one of the only programs that go during the summer, just one summer. Most of the time it's just 4 days of clinical, but we accept 21 students each year. Right now, our process to accept people is open. It closes April the 1st. Now, if we don't have good quality, enough quality candidates, we'll continue that open, through the summer. And so we start each fall. We just start once a year, and I do allow you to go as long as you got all the prerequisites completed. There's maybe a year or so of prerequisites prior. As long as they're completed by the end of the summer, I'm good with that. We have a minimum requirement GPA of 2.75. And our students, well, once you graduate, we kind of work in all different types of facilities, outpatient clinics. We work in, big hospitals and critical access hospitals. We go, so you're always going around the entire hospital. We're in, you do work in the emergency room, you go to surgery. So you're not stuck in one place all the time. So you're kind of going all over the place. And so, which makes it kind of nice. And if you have any questions, as we go, throughout this thing, just ask anything. I'm pretty much, I think all of us are pretty well adversed in most of our programs about what's going on. So I look forward to hearing from you.
Hi, my name is Brooke Ward. I'm the director of the Diagnostic Medical Sonography program here at Newman. Our program is a bachelor's degree, which includes 5 semesters. So our students start every fall. So we take 1 class every year in the fall. And the students do 1 semester of summer. So that is included in the 5 semesters. Our first year, students are on campus learning about our 3 different modalities. That's abdomen, vascular, and OBGYN. And while they're on campus, they have corresponding labs in each of those 3 content courses. Starting in the summer, students do go into 32 to 40 hours of full-time clinical. And while they're in clinical time, the students are still doing stuff through the university. We do keep in touch with students, and they do have a course on top of their clinicals time that they're completing in that fall and spring semester. And the students, when they graduate, are eligible to work in hospitals, clinics, traveling. They can work on machines, any kind of thing like that, that might interest them. Once they are done, they have those options. We've had a really high success rate of our students being placed in positions, so we don't have any problem with that. And the students all pass their boards really well. It is a competitive program. Our program is only able to take about 10 students a year, but with that, it really is dependent on our clinical space. So our clinicals, we do have within our city and surrounding cities, and then surrounding states. So our students are getting a wide variety of clinical time. Let's see, so in the 3.0, like I said, it is very competitive. So we do have usually over 20 applicants every year for our 10 spots, but we do have students that continue through from radiology and come up, and we do enjoy having those students come on over. Or some students we have, actually, I've had a few nurses come over and do sonography as well. So once you're in a field, it doesn't seem like, you know, your interest stops there. You start figuring out all these other areas you like to go to. And so all of our programs are willing to help any of the other programs if the students have any interest. So that's about it.
And just for some additional information, there is the Kansas Promise Act scholarship. And so you can read some of the eligibility criteria there, but our associate's degree programs are on the approved list for the Kansas Promise Act scholarship. So that's the OTA program, the RadTech program, as well as the respiratory care program. So you do have to meet certain criteria to be eligible for that. We do have extra information on that on the Newman website.
All right, everyone. Thank you for that introduction into your programs. At this point, we're just going to have some open Q&A. I already have a question in the chat. Specifically about the medical sonography program, can we take required religion classes online, or does it have to be face-to-face? And what requirements do I need to fulfill to increase my chances at getting admitted into the sonography program? So 2 for there.
Yeah, so the religion class can be online. I don't see any issue with that. As long as it's accepted and can transfer over to the university. If you're taking it at Newman, we do have many options as far as religion courses are concerned. Requirements to fill the increased chances. I always tell the students that are interested in applying to make sure that your GPA is really competitive. Even though we are a 3.0, a lot of the students that apply are above the 3.0. Each of the pieces in the application, the students are a percentage of each of them. So like your GPA is a percentage, your interview is a percentage, all of that comes together, and then we make our decision. So each of those, if you can buff those up, each of those pieces, it gives you a greater chance. Also, outside of COVID, I do encourage students to go do some observation time in the field. Maybe just 8 hours, a couple days, spread it out. If you're allowed to do that, it really does increase interest. So we do like to see that. Otherwise, those are probably the highest points. Make sure that you are a highly eligible candidate.
Thank you. I have a question for Teresa Vetter. Are there any mandatory classes or certifications students need before applying for the nursing program?
No, we don't require anything prior to application to the nursing program. Although once somebody's accepted into the nursing program, they'll be required to become certified in healthcare provider basic life support, and including infant, child, and adult, as well as use of an AED. But other than having the prerequisite nursing courses and then the general education courses to meet Newman's requirements. We don't, and the GPA of 2.85, we don't require any other kind of testing or certification.
From the chat, how does the nursing program prepare students for the Nclex, and how do clinicals work?
So the Nclex stands for the National Council Licensing Examination. And so it's the national examination everybody takes to be eligible to receive a license in the United States and Canada. And it is a computerized examination. And so really the whole program is preparing you both to take the Nclex and to successfully earn the degree and get a licensure and enter into practice. The learning that takes place in the classroom is information that would be included on that exam. The licensing exam will include things that we would expect a new nurse to experience in their first 12 months of practice. We do all of our testing on a computer. We don't do any paper pencil examinations. And that way, at the time you go to take the Nclex, you're used to being on the computer and testing in that method. We do the same setup that they do. You see a question once, you need to answer it at the time that you see it, and then move on to the next one. You're not able to go back and change your answers to any of those questions after you have answered it. The clinical portion of our process is that we have 2 days a week that is spent in the clinical setting. We are giving students the opportunity to receive experiences in several different areas that nurses would practice. We do some community pieces, but majority of our clinicals will be in the hospital setting because that's where most new graduates go to work when they finish nursing. And so we're looking at quite a bit of adult medical and surgical nursing experience, but also pediatrics and obstetrics, and with the goal that you've had enough exposure to be able to be a generalist, which means that when you go into practice, you're able to take care of patients across the lifespan from newborns to elderly, and that are able to provide all that basic levels of care that someone might need.
Thank you. We did have a question in the chat about how a particular class transfers to Newman and if that might count as a history credit. Margot put in the chat the link to our approved transfer courses tool that lives in Jetstream. It may look like you need to log in to use this tool. You don't. Approved transfer courses can be used by anyone. And essentially this tool is a forward-facing list of all the classes that anyone has ever attempted to transfer to Newman. And you can see how they were transferred in, what class they came in as, how many credit hours you get. Some classes that we can't match here come in as general elective, but they still count towards your overall graduation total. If you don't see a class in there that you're looking for, or you don't see a school that you're looking for, it may mean no one's ever tried to transfer classes from there before, but that's okay. There's a way for you to contact the registrar's office and give them a course name, a school, maybe a code and a description, and they'll tell you how it comes over. Someone had asked in the chat, not for any one particular program, but where you can find the application and access it for this spring.
Well, all of our programs, the application is on for the Rad Tech program. It's actually on the Newman website. And so with that application there, you're going to have to write an essay. It's just a one-page essay, for the most part, telling us why you want to be an X-ray tech. So, and then, you know, as long as you got the 2.75 GPA, we're going to allow you to come to an interview. We've been doing the interviews by Zoom like we're doing tonight for the last couple of years because of COVID. And so then we use a rubric to decide, who out of those get in. So normally we have about You know, we're around 30 applicants, so we accept 21. So it's actually a pretty good acceptance rate. So I know they're in the chat. There was another one talking about the chances of getting in. One of those, if we have our associates already, you know, it doesn't matter if you have your associates because this is a professional program, and so I've had people come back in. They've got bachelor's degrees and master's degrees. They come back in just because they want to change in career. So don't look at it as being you know, detrimental just because you have your another degree already.
I assume the other applications can be found on the website as well. I did in the chat put the link to our website where you can find a list of our undergraduate programs. If you were to select the program that you're looking for and they're accepting applications this spring, you should be able to find a link to their application and process on their respective websites. Thank you for answering that, Jeff. We have another question about transferring courses and Gen Eds. So if you're still taking general education classes, when is a good time to apply for these programs? And in general, can people take classes elsewhere and come over as a transfer? You guys have a lot of transfers in our programs, right?
So all of our programs have a lot of transfer students. So while we would love it for you to take your prerequisite courses at Newman, we also understand that many students have accumulated a number of hours at other institutions. So specifically regarding the question that was asked, it will depend on the program that you're hoping to enter, but everyone's looking at your GPA on the prerequisites that they require. So therefore you have to have some of those prereqs in either started, depending on when you intend to enter the program. So for instance, we're in spring semester, respiratory care accepts students to start in August. So someone would have to have some of those courses completed when they apply to my program in February so that I can establish a GPA, but they don't have to have all of the prerequisites done until they actually enter in August. So most of the programs, unless I'm speaking out of turn, you can have, you wouldn't have prerequisites completed at the time you apply, but you have to have them completed prior to entry. Successful completion, which for most of our programs is going to be a C, not a D.
So like for nursing, we require all those, you know, prerequisite courses and general education courses to be completed before starting the nursing program. So as you were going into the semester that you were going to finish those up, that's when you would apply to start the program the following semester. So if you were wanting to apply for next fall, you would need to be enrolled in finishing up those courses or be able to show us that you were going to take some of those in the summer also to have everything done by the time you started in August. If you are applying to come into our program in the spring, then you would need to be enrolled during the fall in all of the courses that would finish up those prerequisites in general education.
Right, I think some of, you know, like especially for radiology, we'd probably go ahead and let you in, but it'd be on a contingent basis, just based off of you completing those and having and meeting the requirements for the GPA and things like that.
Thank you. Another question from the chat. For sonography, is there a test to get into the program? If so, is there a way to study for that test?
So yes, we do have a test, but it's just a general test of skills that ultrasound would require. So it's not something you can study for. It's just who you are and how you see things, and when something's presented to you, how you react to that. So it is not something you can study for. I say all the time that I relate it to like an ink blot, an ink blot test. You know, they show it to you and you just respond to that. So it's not something you can study for, but there is a test.
All right, another question. I had it. For sonography, for observations prior to applications, is there a way to find opportunities for this?
So I suggest talking to the human resources departments at the hospitals. A lot of times they can let you know what the requirements would be for you to do that. Some of the pregnancy crisis centers allow students to come in and do that. Now, these are all subject to change with COVID. It's constantly a fluid situation where we're allowed, sometimes we're not. So, just keep calling. Some clinics allow students, I've heard, I don't have any specific, but a lot of times your doctor's office will be able to, if they have a sonography department there, they will usually let their patient come in and take a peek at, a few exams. I have heard of that. But my biggest recommendation is to go to the HR department at the hospitals and go through their process, because you'll be able to see a lot more variety in that setting.
Thank you. For nursing, how many people typically apply for the nursing program? Is the interview for this program also over Zoom, or is it in person?
You're on mute.
For nursing, we usually have, most of the times we would usually expect to have between 40 to 50 applications for 32 positions. We've seen some decline in our number of applications during COVID, so that has been a lower number of applications that we've been seeing. We actually do interviews, so we meet, individually with each applicant. Since COVID has started, we have been doing those over Zoom, just so that everybody has that option of staying distanced and protected for that interview process. If somebody has a preference to doing an in-person interview, I have also had people come in and do that interview as an in-person also, but we do an interview process.
Thank you. For sonography, what concentrations or specialties are offered, and does each require clinical training?
So we do 3 different modalities. We do abdomen, general, and vascular. Abdomen, vascular, and OBGYN. And they each do require a certain amount of clinical time. So typically when you're out at your clinical site, you'll get abdomen and vascular in that same location. Some locations do their OBs there as well. A lot of offices have branched off, so we would put students in another location to do some OB time. But yeah, they all require a certain amount of clinical hours to be eligible to sit for boards, and each of those have their own board to take. And that is really subjective to each student, whether or not they decide they want to take each of those boards and decide where they would like to specialize, or if they want to be a master of all trades. So it's an opportunity for you, and it's what we offer.
In general, do students need to digitally submit applications to your programs or hand them in person? And if in person, where do they turn them in?
Georgia, I responded in the chat that every program has their own process. And so probably the best way to do it is to contact that program, and then they give you the specifics about whether it's an online submission and if it's in person or paper, where to do that at.
Gotcha, thank you. For sonography, will there ever be a situation that the program will be all online? I know some colleges have gone online because of COVID. How would that happen with the sonography program?
That would not happen for us. We do really value our in-person lab training, and so we think that that's invaluable for being able to do the job. So we do have some of our courses, our content courses and stuff online, and that is really gone well. It increases flexibility for the students to work and to kind of get some of the work done when they feel they can. This is really helpful because students, when they're doing the full-time clinical, they don't necessarily have as much time to do a job, because it is a lot of time. But no, we definitely would keep our labs in person. It's just invaluable.
Are there, and this might be a question for each of you briefly, but is there something in particular you're looking for in your applicants, or that you like to see that students can prepare for? What are you guys looking for in applicants?
Well, for radiology, we especially on the interview process, we look for communication skills because most of our patients don't know what position they're supposed to be in. So we have to be aware of, about different types of people. And so, because we image people all the way from, infants all the way up to geriatric. And so we have to be able to deal with each of those sets of people. So communication skills are very important for us, in which I would assume it's important for all of our programs. I look, part of it, Brooke, she mentioned about being able to shadow someone. If you can do that, that's great. It's not going to be detrimental to you because we know that sometimes you can't get, especially with COVID, you can't get into, places. But so what happens is for us, when you get into the program, we actually send you to the hospitals for 16 hours of observation just to make sure this is something that you really want to do. So we want to, some of these things are not meant for every person. It may sound good on paper, but once you actually see it, it may not be something you want to do. And then for the rest, we can also point you in maybe a direction for any of our other programs that might interest you as well. So
I think I would also add on to that. Our applicants were really looking for you to be organized, to be aware of the deadlines, really to pay attention to detail, because those are going to be key skills for you to be successful in all of these healthcare fields.
Yeah, I would echo what Nancy said about detail oriented, as well as the communication skills, but also that shadowing experience is very important for you so that you can see what the day-to-day work is like, and to make sure that you're a good fit for that, that's what you expect it to be before you spend a lot of time and money to invest in a profession, because these are professional programs. And if you don't intend to continue to work in that area, it's probably not the best thing for you. You might be better suited getting some other type of degree. We want people to find the profession that they're well suited for, that they're going to enjoy working. And then we also want everyone to understand that with an associate's degree program, these are professional programs. So they're a lot more rigorous than students sometimes think they will be. Whether you're going to a program that is, so I'll use my own for an example, respiratory care, there are some bachelor's degree programs, and there are more associate degree programs than bachelor's degree programs, but we're all sitting for the same exam. So we have 3 semesters to get you to the same point that another program might be spending 5 semesters just on respiratory. So it's rigorous. We can get you there, but you have to be dedicated and committed. And Brooke had mentioned, people trying to work and things like that. So you have to consider that and how important it is to you to complete your program on kind of a shorter timeline, and whether or not you're going to have the time to dedicate to your education.
Yeah, I agree with everything that they all said exactly. I think that one of the things I really stress, and Margot really hit that, is professionalism. We have to know that we're going in and we are going to be a professional, and this is a very important thing, delivering healthcare to our community. So understanding that when you're putting in the time, I tell my students all the time, it is a lot. Because it is, and it needs to be, it's important, but it is a season. And it's something that you just go in with that mindset, knowing that you're going to put in that time and that's what you're going to do. And then when you get done, you have that sense of accomplishment and knowing that you are going to be a professional and that you've put in that time, and it deserves that. So I think all of those things, detail, communication, being organized, all of those things are characteristics of a professional, and somebody who has that mindset coming in will do very well.
Yeah, and I would add that, for nursing, not only are we looking at all of those things, but we're also looking at those who have, an interest in the sciences, have proficiency in math, that like to solve problems. Healthcare can be like a puzzle, and you've got to be able to fit those pieces together. And sometimes it takes searching every single piece on the table to find the one that you're trying to get to fit. And that has to be something that you enjoy and are willing to do. And so I think for all of these, for nursing, we don't do any shadowing or require any shadowing. But I think it is important for every healthcare profession that you've looked at what is involved about this profession. What do they do? What are the expectations? So I think spending some time looking at that profession and what information is available out there is also very important. I usually tell students that, nursing school is hard, but being a nurse is hard. It's hard work, and it will always stay that way. And it's got to be something that you really enjoy and want to do to be willing to work that hard.
I know that, if you're coming into Newman University and you are preparing to enter one of these programs or to apply for one of these programs, we do give you an advisor in this area of study, even while you're just, doing prereqs and gen eds. So maybe one of you, can you talk about what like an incoming freshman schedule might look like if you're coming in pre-nursing or pre-sono or pre-OTA? I'm sure it varies if you're an associate's versus a bachelor's program, but can you talk about what that might look like?
Yeah, it's I work a lot with freshmen coming into Newman, and we're usually looking at trying to arrange to take around 15 credit hours each semester, which is going to be about the same as taking 5 classes. Most classes are going to be approximately 3 credit hours. And that means you're spending 3 hours a week in that class. So that may be that you go for 1 hour on Monday, Wednesday, and Friday, or it may be that you go for 1.5 hours on Tuesdays and Thursdays. But to do 15 hours typically means that you're going to be spending probably about half of the day, Monday through Friday, in the classroom. And then for each one of those courses, you should plan on that you're going to have each week between 3 to 9 hours of studying for each course to understand the materials. One of the things that's so important in the healthcare professions is that every class you take prior to starting in the program is building a foundation to understand the content that will be presented in the program. So, when you're taking anatomy and physiology and even college writing courses, all of those are going to be essential information that you have to actually have learned and own the knowledge from it when you come into the program. Because if you have to go back and review all the courses that you took previously to understand what we're talking about, you're going to have a lot of work to do. And because we won't have time to repeat what you already took in previous courses. So, it's, I would say, a full-time college student preparing to come into a professional healthcare program could look at their schooling as being like a full-time job. They should plan on that they're going to be spending like 40 hours a week dedicated to their schooling throughout those 4 years or 2 years or 3 years of getting that education.
Thank you. All right, this is the last question I have. And then after that, I can talk a little bit about scholarships because we had a ton of questions submitted on the RSVP forms for that. I know, there's tuition, there's fees, there's room and board if students are living on campus and they can use financial aid and scholarships. For your guys' programs, what kind of additional or extra costs should students anticipate when it comes to, maybe background checks or testing or, you know, anything else? What can they expect out of your programs?
I think you hit it right. Now, some of those things are everyone has to do a background check. You know, you got to make sure you have all of your vaccines and everything up to date. Some of the things you'll do on an annual basis, such as the flu, those may cost you a little bit. We all have, when you go to the clinical setting, you're going to end up having to wear Newman scrubs. That is also incurred cost. You know, when you graduate and you take these certification exams, you know, each of our programs, the cost is going to be a little bit different. I know for radiology, that certification exam is going to be $225. So those are just some of the costs that you can typically incur from each of our programs.
Thanks, Jeff. Well, that was all the questions I had submitted in advance. But because you guys are on this call today and you had so many questions about scholarships, again, my name is Georgia Drews. I'm the Associate Director of Admissions here at Newman. Been kind of running things in the background because this is health sciences show. But we had a lot of questions about scholarships. So I wanted to tell you that the application for admission to Newman University is almost always free. I know we have some international students on the call, so if you're an international student and you apply for admission, there is a $25 application fee. Otherwise, there's no cost to apply to the university. For first-time students, we consider first-time students to be anyone that's coming to us out of high school. Even if you took college credit during high school or in the summer after graduating high school, we consider that concurrent credit. So we're not treating you as a transfer, even if you come in with a ton of college credit hours. So first-time students are those that are actually attending a college for the first time. Some people call them freshmen, but you know, you could be a junior and still be a first-time student. If you apply to the university, we'll ask you for an official high school transcript. We've been test optional since 2019, so we do not require that you submit an ACT or SAT score. We will admit you and scholarship you automatically as long as you're admissible based on your GPA or ACT, whichever one gets you a higher amount. And the amounts you see here are $10,000 to $16,000 per year for 4 years, as long as you maintain at least a 2.0 GPA. You do have to continually enroll full-time to be eligible for this scholarship and to be qualified for the full amounts of financial aid that you might get on the FAFSA. Do have to have at least a 2.25 GPA or a 21 on the ACT to be admitted here automatically. You don't need both anymore. For transfer students, transfers are anybody that's attended a post-secondary institution after graduation, like actually attended one, not the concurrent credit. You apply to the university. We request that you send in transcripts from every college that you've attended credit at, even the ones that you did in high school. If you have less than 24 transferable college credit hours, we may ask you to also send a high school transcript. But we also need you to have at least a 2.25 GPA to be automatically accepted and scholarshiped. The amounts you see here for transfers are $11,000 to $15,000 per year based on your cumulative transfer GPA across all of your colleges, and it's $11,000 to $15,000 per year for 2 years. We are aware that some students are transferring to us after only maybe a semester or 2 or 3 at another school, so that you need more than 2 years to finish a degree. If you know that's the case, contact us immediately upon enrolling for classes, and financial aid will give you the opportunity to appeal to receive a 3rd year of this scholarship, maybe more, depends on the situation. So yeah, I just wanted to let you know that. If you're interested in coming for a more personalized, customized visit to campus, we are doing individual in-person and virtual campus visits. We'll get you on a walking tour of campus. We'll have you meet one-on-one with faculty in your area of study. You can elect to meet with our honors program director if you qualify for that program. If you come in the morning, you can opt in to eat lunch in our dining hall or go to mass. And then you do get to meet with an admissions counselor to talk more about, you know, the different admissions policies, things that we offer on campus, as well as financial aid opportunities. So if you guys have any questions about that, or you'd like to schedule a visit, I'm going to put in the chat the link to apply. Also going to put the link to visit if you wanted to do a more personalized visit. Any closing comments from our faculty directors here on the call? All right. Thank you guys for joining us tonight. We are recording this session, so we'll send that out. We'll put it up on YouTube most likely. And if you know anyone else that might be interested in coming to Newman for a health sciences program, this could be really informative for them to watch. We'll keep an eye out for your applications this spring. Let us know if you need anything. Have a good night, everybody.